that we adopted this year. Before we started our meeting in New York City, we would take 1 minute, literally full 1 minute, 60 seconds, where we all closed our eyes in the room and we started breathing. So this is why we have this screen saying breathing. So when people join, they don't freak out that we're not here, nobody's talking and the meeting has not started. The meeting has officially started, but I ask you all, we're all coming from so many different places in the world and stresses and anxieties. I want us all to be present, and I want you all to close your eyes and take a deep breath. I will count the minute and I will bring you back into the meeting and we will proceed. So close your eyes, take a deep breath and present yourself in this moment. And I will see you in 1 minute.
Like 7 Tropicana with no pulse. Well, no, hold
on. Okay, welcome all. For those of you who joined us in the last 1 minute, we were taking a deep breath and centering ourselves in this moment. I am so pleased you are all here joining us. As I was saying earlier, this is the first time NGO CSW is bringing their monthly meeting to our global audience, and I'm so pleased. And I will suggest eventually, if you can, turn off your cameras later on. Right now we're okay in the business meeting. When we have our speakers, I think it just makes it easier. But let's try it. I love seeing all of your faces. So I'm so glad most of you have your cameras on. Thank you all for being here. Well, good morning, good afternoon, good evening to you all. Again, as I said, my name is Houry Geudelekian. I am the chair of NGO CSW. And welcome to a new way of doing all our work that we're doing, right? It is actually an advantage to be able to put this online and bring all of you to our work. I want to start by saying that as you all have seen our emails and you've all reached out to us and thanked us as well, we of course regret CSW 64 was canceled. Refunds are on their way. This is the business part of NGO CSW. Almost all of them are done. The banks actually had slowed us down for the refunds because they wanted us to take our time in doing so for different reasons. So thank you for everyone's patience. Everybody who did parallel events, bought tickets for consultation day reception will be refunded. Those of you who chose to donate it to us, I want to thank you again. We are very sad that we are not going to make the money that we usually make that sustains us for the year, but we'll be fine. We're so grateful for our partners and supporters. We will be fine, and we are going to come back stronger than ever for CSW 65. So don't you all worry. CSW 65 will happen in some shape, form, no matter what happens. I also wanted to take this opportunity to thank my team, the executive committee, some of whom are on this call right now. I see Susan O'Malley, I see Ivy Koek. And our vast planning committee, over 50 volunteers met throughout the year to organize CSW 64, and I'm sure most of them will be back to help us organize CSW 65. So we will be here in New York City putting this gathering together again. At this moment, I also want to thank our support staff, our interns, and Devin, who is doing an amazing job helping us go to online and running this meeting right now. But I want to introduce her. I want to thank her and introduce her so that she can let you know about Padlet and how we are gathering some information. Devin, the floor is yours.
Hi, everyone. So we have a little something called Padlet. I'm going to post the link in the chat box right now. So when you go to this link, it's pretty much you're just going to like post a little notepad on the board. There's a couple questions. You're going to put your name, your organization, where you're from, and then the two most important questions are, what are you doing during these virtual times? How is your activism being affected besides just moving meetings and events online, since most people are doing that? And the last question is, what kind of solutions have you found helpful with your online activism during this time? So when you click the link, there'll be a little plus sign in the bottom right corner, and then you can just add a post and add your answers. And this is going to give us, an idea of who's on the call, and also give us some ideas about recommendations and what people around the world are doing to support this virtual activism that's happening right now. So you can click that link and do that at any time during the meeting or afterwards. Yeah. If you have any issues with it, you can put in the chat and I'll try and help.
All right, how fantastic is our Devin? She's been amazing. And I hope you all utilize the Padlet that we've discovered through one of our partners. Actually, you're going to hear from Hannah later. She's the moderator of our second panel. She's been amazing helping us navigate through all of these technologies. And also for any of you who are new to NGO CSW, this is basically what we do. We like to gather people. We like to bring activists together. We like to gather information and share information. We are activists, but we are mostly a gatherer of information and distributors. So we really thank you all for supporting us in these endeavors. So I mean, I can go on and on forever about the situation that we find ourselves all in. It is heartbreaking, but it is all, and I do hope that all of you and your families are safe and you stay away from the virus, and that we together survive this. But at the same time, we're also invigorated, and we're realizing how much information is out there and how this virus itself exposed to all of us. There's really nobody that can say, no matter how privileged or unprivileged they are, that can say, oh, we've had a pretty good world here. No, we were not. We were not really serving our population well. We were not delivering on promises for women and girls, and we were not eradicating poverty. All of these issues that we've all been fighting for in different ways, we were not achieving them. So I'd like to think, and my team agrees, that this is an opportunity for us to really push forward ideas that we know can work. So today's meeting actually, and I hope you all relax in your chair and enjoy all the information that we'll be sharing in the next couple of hours. Today's meeting is all about really looking into how are we responding to COVID-19 and what can we do? So by the end of this meeting, of course, we'll always share the recording, the minutes, but we're also hoping to come up with a one-pager of bullet points of information that we've gathered that all of you can use for your own organization, community, and and then also hopefully you can bring us back more information. For example, with the Padlet, you can sign up there. But while I have a few more minutes, I do want to also highlight that we have brought many of our events that were canceled during CSW 64 to our virtual platforms. And our website, which is still in progress, we're always trying to improve. As you know, our organization is 99.9% volunteer-based. We have one office manager. We do have an IT person who works part-time. So we do the best we can to develop all of these platforms. But I'm a volunteer. Most of my executive committee is a volunteer. So we're doing the best we can. But I am excited to say that we were able to pull off Consultation Day online. You can see a link of that if you missed it on our website. A lot of our parallel events did go online, and we have an app that you can download in Guidebook. And you will see a lot of these parallel events that took place online. And that's the beauty of online too, right? Once you do it online, then it is definitely available for you to watch later. We also have a few really wonderful events coming up. There was one event in our conversation circle that was transformation through interconnectedness that we were really excited about, because again, even before COVID-19, we were very much aware of the craziness this world was bringing into our lives, and we were trying very hard to keep coming, centering ourselves and being present and really moving from an interconnected place with nature, with each other, so that we're breaking silos, we're not duplicating the works that we are doing. All of that comes from within, right? We have to first be centered here, and then in our groups, and then in the larger community. So that transformation through interconnectedness happened once. It was so well received that the person, Malika Dutt, who was running it, has agreed to do 3 more. Again, you can see the dates. The next one actually is this coming Monday. You can still sign up for it. And then there will be 3 more. Altogether is 4. So one happened, one is happening this Monday, and then 2 more in the future. Again, all of this information is on the website, but if it is hard to find, please email us at info@ngocsw.org, and our fabulous Devin and her team of interns will respond to you as soon as they can. And I'm so glad people are utilizing the chat box, sharing all kinds of information. Thank you so much for that. Let me see what else. Oh yes, we have another amazing event, and I think we're sending out an email very soon, today or tomorrow. The Young Professional event that was going to take place Wednesday afternoon of CSW 64 is coming to our virtual platform. It is scheduled for April 30th, so 14 days from now. It's not limited to young professionals. Anybody and everybody can sign up and attend, but it's really a platform to give youth a voice to join us in this campaign. And what campaign are we talking about? If people are not aware of course, Beijing 25 is still a priority for us. Just because we did not have CSW 64 and we did not celebrate or demand our rights for Beijing 25 doesn't mean we're stopping. It has not stopped. It is actually continuing. And as NGO CSW, we will do our best to bring all of those voices into CSW 65, no matter what the topic is, which we know obviously what it is. It's already agreed upon. But, and at the same time, there was also, NGO CSW was also so proud to be involved and a convener of a campaign that UN Women led called Generation Equality. That is still going strong. And some of you know the forums themselves that were going to take place in May in Mexico, and in July in Paris. Both of those are postponed to early 2021. But I want to just take this moment to let people know who are aware of it, are following, or are new to it. The forums were important, but they were not the only piece of this campaign. For me and for the partners that I'm working with, the campaign is a global campaign and it's an ongoing campaign. The forums will be important perhaps to highlight and to shine a light on the work that we're doing, but the work is ongoing right now. So we have several groups that some of them are still open for you all to join. Most of this information is on our website again, but there's a group called FWMAP, Feminist and Women's Movement. And we've been meeting for months and months now on Maestro and, collecting expert information from experts on different thematic groups. And that group actually is doing some amazing work after consulting on all the thematic groups. Now they're shifting into partnering with universities. Again, all of that information on our website. There's obviously CSAC, the Civil Society Advisory Group, which I'm also part of. That group is meeting regularly, working with the core group, which is UN Women, France, and Mexico. And there's also the larger advisory working group, and that also is open for anyone who wants to join. And you can email either beijing25@ngocsw.org or info@ngocsw.org. And I can see Devin sending all kinds of information in the chat room, and obviously all of this will be in the minutes as well. So that movement is going strong, and I'm so proud of the way feminist movement has come together even before COVID. And I feel like we're raising the bar with this pandemic, because we are realizing that we were always right in our demands. And now we really need to move on it. And how do we move on it so that, like I said before, we are not working in silos, that we are not all overlapping the same work and not realizing, which slows us down and doesn't move us forward. So these platforms that we're creating is all about that. And I'm seeing a lot of my sister organizations, and you will hear from some of them later on in our panel. And those are only a few of them. There were so many more that my partner Ivy and I, which I will introduce you in a minute, and she'll be the moderator for the first panel discussion. When we started thinking about this meeting, it was like pow, pow, pow. So many ideas came to mind on people to reach out to and people we were asking to join us, because so many people are responding to this pandemic with strong statements. So we're happy to be part of this galvanizing movement and welcome you all. And I do hope that you all keep in touch with us and share your ideas with us, because that's how we're going to move forward. Let me see if I forgot anything else. There are actually, there's a lot of information on our website. So there's statements and then the parallel reports that are up there. We just very recently uploaded a statement, a parallel report with Beijing 25 from New York City, of all places. So I'm really pleased with a group of activists who came together and put together this amazing document. I mean, it's so much information. You're gonna hate me when you click on it and you see 40 pages, but it's really, really good information. So you'll find that on our website as well. I think I really covered all the bullet points that I had made for myself. And I hope I was able to convey my excitement of being here and being privileged and honored to be in this position to share all of this information with you. And we have a few more minutes before we start our panel, but I think we can jump right in. I will give the floor to my partner, my amazing vice chair, who has been like a rock throughout this process. She's part of the executive committee that I already thanked, and I see more executive committee members on this. So I'm going to give the floor to Ivy. She will have 45 minutes with quite a few amazing people who are going to report to us. And then we will give the floor to Hannah Gunnarsson, who is going to take over for the next 45 minutes. But please feel free to keep, and I will keep an eye on the chat right now, since I'm done talking for now. So I thank you. In case I don't see you later on before we sign off, I thank you again for joining us. And I'm going to give the floor to my Vice Chair, Ivy Koek.
Hello, everybody, and thank you for joining us. It's so nice to see all the familiar faces and names. I feel like, you know, we're kind of coming back home to the committee. And so, as Houry already explained, and as everybody is probably inundated with so many statements, impressions, messages during this time, we really wanted to spotlight the current pandemic that we're living in right now. And this portion, this first portion of this, we'll have 3 speakers, and then we're going to have a respondent at an intervention, I would say, between the 2 panels. I'm not sure if that was mentioned in your program, but Kalyani, I hope she is on the call. I can't scroll to check that she's on, but I'm just giving her a little warning that if she is on, then we're going to hear from her before I hand it over to Hannah for the second part. But for this first one, we wanted to start first from, since we are engaged with the UN, we wanted to hear the UN response to what is going on and their approach at this particular time. And that is from Vivek Rai. And I want to give a little bit longer introduction to him because I don't think that his bio is in the program, and so I'm going to give a little bit more of a bio of him before I hand it over to Vivek. So he's the deputy of the Civil Society Division of UN Women, based in New York, and he's held that position since the 2014 in December. And his work includes strengthening strategic partnerships between civil society and UN Women, including expanding the work at the country, regional, and global level. I should add that he is involved in the Generation Equality Forum as well. I'm sorry, I forgot the title of that. He's going to have to clarify. It's probably on the program. And Vivek has been working in the development sector for over a decade, including progressively with UN Women, and its predecessor UNIFEM since 2009. And prior to his current post, he helped coordinate the initial stages of the global study on the 15-year review of Security Council Resolution 1325 on women, peace, and security, as well as setting up the UN Women Regional Office for Europe and Central Asia in Istanbul, while working for the Policy and Program Bureau. And Vivek has a background in broadcast journalism, which I didn't know, worked as a news producer in India, the UK, and the US before joining the UN system. And again, he's gonna update us on the strategy that the UN is taking on the COVID-19. So Vivek, I hand it to you.
Thank you very much, Ivy, and it's great to be connected to all of you. I recognize some familiar names and others I don't, so very good to meet those of you that I don't know. So as Ivy said, I work at UN Women. I'm the deputy in the Civil Society Division, and the other part of my title is the Civil Society Coordinator for the Generation Equality Forum. As most of you already know, the forum has now been postponed because of the effect of the COVID-19 sort of pandemic that has struck the world. And the work of UN Women and of the UN system at large has now pivoted very strongly in terms of how to respond to this immediate crisis. The UN, as you know, the SG has been sort of making public statements about this. The UN, of course, has pulled together a task force, an integrated task force, to work very sort of cohesively on a UN response to the pandemic. And within that work of that task force and within the sort of the advocacy of the SG, there has been a very clear and clarion call for looking at the very specific gendered impact of this pandemic and to sort of address that and to have a response to that. And so that's been a very sort of strong call from the SG himself. And then that's also trickling down to the rest of the UN system. Just anecdotally, what I would like to also share with you is that even in terms of the conversations that are taking place with donors, with governments and this thing, they are also looking for the UN to come together. So it's not necessarily looking about, you know, giving resources to X, Y, or Z, but to actually have a more integrated and a cohesive response from the multilateral system in terms of how to move forward on this, on the situation that we have. And what has been asked of us right now is to pull together a set of strategies which have a short-term impact, which have a medium-term impact, and which have a long-term sort of a timeline to them. The fact of the matter is the world as we know it has changed radically, and it's unlikely that we will go back to the idea of whatever was normal a few months ago. In some ways, you know, there's an opportunity that lies within that sort of moment. As difficult as it is, and as problematic as it is, there is an opportunity here to sort of redress some of the issues that you know, women's rights organizations have been advocating for a very long time. So in that light, I just want to talk a little bit about the work that UN Women is doing, and to place that in front of you. We are seeing already, and I know this is something which, and this is with many thanks to all of you who are at the forefront of this work. UN Women is learning a lot from you through our partnership with NGO CSW, but also through our partnership with other sort of global and regional organizations, and certainly most importantly with our partnership with grassroots and national organizations, many of whom are represented in this meeting today as well. So thank you very much for your work, and we are learning from you. So what we are picking up already right now is the fact that, you know, globally women make up about 70% of workers in the health and social sector. Globally, women are doing 3 times as much unpaid care work as men when health systems are overloaded. A greater burden is being placed in the care of the home, and the burden is lying largely on that with women. As the Secretary General has said when presenting his report, COVID-19, you know, the great danger, I talked about the opportunity, but the great danger that we are seeing right now is that we could see a huge reversal in even the limited progress that has been made on gender equality and women's rights. And what we were using the Generational Equality Forum was to talk about advancing those rights. And right now we are in a situation where we are talking about actually holding on and actually making sure that there's not a backslide in that. Because we are seeing a rise in violence. We're seeing a rise in domestic violence. We are seeing a rise in online violence. We know that that one of the offsets of this pandemic, even if there's a coming down of numbers, even if we are able to stabilize the health situation, we know there's a long-term economic impact that is coming upon us, and we know that women will be the hardest hit around that. So we can sort of look at that, and this is across the spectrum. This is in richer countries. This is in developing countries. We see this across the spectrum. I have to say, at an anecdotal level, again, I was very struck by the one. Many of you subscribe to the one sort of listserv, and I was very struck by the fact that, you know, today there was an article in the one listserv which talked about the fact that landlords in the United States are seeking sexual favors of women as a way of ensuring that they're able to stay on in their homes, and because they're not being able to pay rent. And you know, this is just one anecdotal sort of like moment which I wanted to just share, and many of you have probably read that this thing, but just to see, you know, the fact that we are entering into a space which is an incredibly difficult space. This thing in terms of the health sort of services, you know, we are seeing that as a result of the focus on COVID-19, a lot of resources which are gendered resources in terms of the work that have on health services for women are being diverted to focus specifically on COVID, but that is going to have an impact on women's overall health. So what is it that we are trying to do, and what is it that we are asking people to do? In terms of the work at the UN, where we are not in the forefront, we support those of you who are in the forefront of this work. So what are we asking people to do? What we are trying to do is to ensure availability of sex disaggregated data that is viewed through a gender lens, because we need that data to ensure to emphasize the importance of the gendered impact of this situation. We are proactively building gender expertise into response teams and embedding gender dimensions within response plans that are being put together both at the global level, but also at national levels. That's the other element of what we are doing. We want to provide, we are asking our partners and our donors to provide priority support to women on the front lines of the response. This includes creating better access for healthcare workers and caregivers to women-friendly personal protective equipment, menstrual hygiene products, promoting flexible working arrangements for women with a burden of care. These needs are even more important for areas under lockdown or quarantine. We are asking for ensuring equal voice for women in decision-making and recognize the critical role of women's networks and women's organizations in the response to the COVID pandemic. We are asking for the ensuring that public health messages probably target women, including those most marginalized. At a time when many of us have moved into the virtual space, I think many of us will acknowledge that at least, we already have had challenges which we have been trying to address, both in terms of the work that all of you are doing, and also in the terms of the work that we were doing with the Generational Equality Forum, to say that how do we reach out to the most marginalized? Now, in a space when we are moving more into a virtual space, that marginalization is in danger of becoming even worse. Because for the fact that people who don't have access to virtual spaces, and how do we ensure that marginalization doesn't actually become greater? Developing mitigation strategies that specifically target the economic impact of the outbreak on women and building women's resilience. This includes a focus on sectors where women are overrepresented, such as daily wage earners, small business owners, and those working in informal sectors. I've already talked about the fact about building gender expertise into response teams, working closely with the World Health Organization and other UN agencies and UN country teams to strengthen our coordinated response to this outbreak, leveraging our existing network of relationships with women-led organizations such as yours and others to advance women's voice in decision-making in all aspects of preparedness and response, providing technical expertise to support risk communication and community engagement to reach women, persons living with disabilities and marginalized groups in order to address their unequal access to information on outbreaks and available services. We have done this in the past in relation to Ebola and Zika, and we can learn lessons from that. So building on things that we have already learned from past experiences. Continuing to focus on our existing programming, even as we pivot into this COVID response, continuing to focus on programming that builds women's economic resilience for this and future shocks, so that they have the resources they need for themselves and their families, and then preparing for future crises by extracting lessons from the current situation, as well as I have said already, from past experiences such as Ebola and Zika. So I have put in a nutshell what is a much more broad-based set of work that we are doing, but in the interest of time, this in a nutshell is how UN Women is working on this area of COVID-19 responses. Ivy, let me know if you want me to speak further, or otherwise I'll stop at this moment and see if there are any questions.
No, but there's a lot of people wanting to see your face. We weren't sure.
Oh, I am so sorry. I am so sorry. I thought I had my video on. Apologies. Apologies. Sorry.
Everyone, this is Vivek.
Hi.
So we can. Happy to see you. And we are recording this, and so we will share everything. And everyone's appreciating you for what you shared. We'll have more time for questions afterwards. So then at that time, we'll swing back. If people can also direct their questions to, what speaker, who they're directing their questions to, that would be helpful as well. So thank you so much, Vivek, for all that you're doing. Of course, you're staying ultra busy, it sounds. So take care, and I'm going to move on to the next speaker. And so Dr. Marianna Leite, who's based, I believe, in Brazil. And she's the global lead on gender and inequality at Christian Aid and the chair of the ACT Alliance Gender Justice Reference Group, and is a legal scholar and a gender and development expert with considerable experience in international human rights law, strategic litigation, in-depth gender analysis, and qualitative data gathering. She's also worked with Action Aid and the Center for Reproductive Rights. I'm going to pass it to Marianna to give a faith perspective, or the faith-based organizations and how they have responded. Okay, Dr. Leite. And if you can turn on your video too when you speak.
Hi, thank you. Can you see and can you hear me properly?
Yes, we can see and hear very well.
Great. Well, good morning, good afternoon, and good evening to everyone. Thank you, Ivy and Houry and Devin, for the invitation and for sorting out the call arrangements. I think you probably can see already on the screen the presentation. For those of you that don't know, ACT Alliance is a large alliance of faith-based organizations. We have over 135 members, and we have a presence in around 120 countries. We work on humanitarian aid, on development projects, as well as advocacy strategies. And we've been doing that for the past 10 years, though we have members that have been operating for much longer than that, such as Christian Aid, which has started in the aftermath of the Second World War. So there is a wealth of experience which we try to harness in the shape of our different programs. In the next slide, you'll see that gender justice is a priority for ACT Alliance. It has been prioritized in our strategy in the 2019-2026 global strategy. And it's coming to fruition through its gender program. The gender program tries to harness our unique position as a Christian-based Christian-based alliance, but also tries to look at the interfaith elements. How can we reach out to other faiths, and how can we also go beyond faiths and to work with secular actors? And we do it in a way that we tackle the immediate needs, but we also look at transforming structures. How can we provide long-lasting change by using the entry points that are available to us because of our faith identity? I know that, and you see on the next slide that many of us have been receiving a lot of statements, calls on the gender dimensions of COVID. We as ACT Alliance have been trying to respond as well, always through a gender lens. So we have a humanitarian appeal with a strong gender lens, which is our global response to the COVID-19 pandemic, which you can see on the screen. The ACT Alliance Secretariat based in Geneva, as well as the different members, have established coordination mechanisms at the global, regional, and national level to make sure that our response is gender sensitive, and that comes in different shapes or forms. And lastly, though certainly not least, our Gender Justice Reference Group, which is the highest body in terms of the membership advice to the Secretariat, is currently working on a briefing paper on the gender dimensions of COVID-19, and we're doing that from a faith perspective. I'll mostly talk about that particular part of our work, but I'm happy to answer any questions if you have any about the other aspects. The briefing paper has three, and on the previous one still, has three aims. One is focusing on our added value as a faith actor and our capacity to mobilize faith communities. Two, which is looking at the short, medium, and long-term effects of the response. So it's not only the disease, but the response, and understanding that, as Houry was saying at the beginning, that it wasn't COVID-19 that created inequality. It's just enhancing or making inequality and social exclusion worse. And third, we're providing recommendations to our members and our other stakeholders beyond the alliance to make sure that appropriate gender response is taken. On the next slide, you will see what do we mean about the faith dimensions of COVID-19. As you know, many of us in this call might know, faith is a source of hope in moments of despair and crisis. It often guides us through the values of love, compassion, and solidarity, and it helps to create this sense of fraternity when some of us are suffering. Unfortunately, as we've seen, even prior to COVID, faith factors haven't always been a positive driving force for change. Unfortunately, some of them have been responsible for backlashes against women's rights. And lately, as part of the COVID-19 analysis, we were seeing that in many countries such as the US, South Korea, and Brazil, irresponsible faith practices have been responsible for the dissemination of the virus and the high rates of contamination amongst faith communities. As a result of that, and also as based on previous research that has been done by the WHO, and surely in collaboration with many agencies such as UNFPA and UN Women, it issued an interim guidance recognizing that religious leaders and faith-based organizations can and must play a major role in saving lives and reducing illness related to COVID-19, and adequately abiding by and promoting scientifically sound guidelines. ACT Alliance itself, as a progressive faith-based organization which is driven by human rights and uses a human rights-based approach to all its programming, humanitarian responses, and advocacy strategies, we have a clear stand that we do not accept any discrimination on the basis of gender identity, sexual orientation, and any other social markers as nationality, race, religion, or belief. And we believe that we can and must use our faith for to make sure that those transformations that need to take place happen, and they do so in a positive way that transform the lives of women, girls, men, boys, as well as LGBT plus individuals. And as you will be able to see on the next slide, we've considered, so we divided our analysis or our considerations in terms of the short term, the medium term, and the long term aspects of the response. I'm only sharing with you some of them as we are speaking. Our briefing paper is being developed, so it hasn't been finalized. So I think this is a timely discussion to have with you. So any recommendations, any suggestions are very much welcome at this point. We're very eager to make sure it's a holistic approach and that takes into consideration not only the faith element, but also how faith and secular actors must interact now. In terms of our short-term considerations, we're looking very much at our humanitarian response and things such as containing the spread of COVID pandemic and the decrease of morbidity and mortality. So, and basically that means minimizing the health impacts. So decrease the deterioration of human assets and rights, social cohesion and livelihoods, and protecting, assisting, advocating for refugees, internally displaced persons, migrants, and communities particularly vulnerable to the crisis. And that goes back to Vivek's point about those that are most marginalized. So staying true to the pledge and enshrined in the Agenda 2030 to leave no one behind. In terms of the medium-term considerations, which you'll see on the next slide, we're focusing on mitigating poverty and social impacts. How can we make sure that we look at poverty, inequality in a comprehensive way and use this opportunity to not only tackle the impacts of the COVID-19 response and lockdowns, but also look at this as a way to also tackle issues that haven't been tackled. I think the normality that we were used to wasn't really normal. I mean, we were experiencing high rates of inequality, high rates of poverty, and that's just simply not acceptable. And I think this is a good moment for us to think through some of the things that we really must change. So some of the things that we've been considering, and particularly focusing on women and girls, so we do consider the gender as a spectrum. Looking at the gender dimensions of care work, high rates of sexual and gender-based violence, the disinformation and misinformation spread out through different mediums such as WhatsApp, Twitter, Facebook, or even any other interaction that you might have directly, particularly when talking about the position of faith leaders, the lack of access to appropriate public health system, the need for social support, the lack of access to formal and informal education, and how the lockdown might affect that access. So some girls are being pulled out of school and in contexts where online schooling is not really available. So what does that mean for the aftermath? Are they going to be able to go back to school? Or are they going to be pushed to provide an extra income for the household? And then provision of food and food security. So what does that mean in countries that have been their food systems disrupted? And then lastly, economic justice and social injustice. In terms of the long-term considerations, which you'll see on the next slide, we are looking at modifying structures responsible for oppression and responsible for keeping people marginalized and excluded. We're very much concerned about the economic dislocation that will be caused by COVID-19 and possibly the recession that might follow suit after lockdowns. And we are particularly worried about the effects on women and girls and how that might affect their security in all aspects, not only in terms of physical security. We're also concerned about how economic institutions and economic players are overly focused on profit and growth. So some pushing for the end of lockdowns in spite of sound scientific knowledge and not taking into consideration people and the fact that people will suffer and die if we don't follow sound scientific advice. And also we are really very much looking at this as a way to really rethink our current economic system that multiply existing patterns that increase inequality, poverty, and social exclusion. So we can see that this virus is showing that it affects us all. We are all affected, but viruses does not discriminate, but systems do. So how can we make sure that in the next time around, and Vivek did mention Zika and did mention Ebola, so the next crisis that we face, we don't see the differentiated impacts that we are seeing, which are very, very acute depending on the context you're looking at. On the next slide, you see our recommendations, and that's the last slide. We have many, so those aren't all of the recommendations we have. We're focusing very much inwards as a priority. So how can we as an alliance respond better, and how can we make sure we are having a cohesive approach, but also we have recommendations for other stakeholders. So for example, we call ACT Alliance members to come together at national and regional level in order to create spaces for strategizing and cooperation to respond to this crisis in solidarity, in a compassionate and effective way. So how can we care for each other? How can we really, really, truly care for each other, regardless of how they're connected to us on an individual level? Secondly, and that's also an example, as I said, this is not an extensive list, or exhaustive list. We call on governments to ensure women and girls are having limited or no access to healthcare to be referred to, or to make sure that they have access to healthcare facilities, including psychosocial support. And that again goes back to the systems approach. So how can we make sure that we have appropriate investment in public health systems? They are the ones that need to respond to any crisis. And then we call on our members to collect, systematize, and analyze gender disaggregated data. Vivek also mentions this. So how can we make sure we understand to address the long-term effects of COVID-19 and the curtailment of social, cultural, economic, civil, and political rights? And lastly, we call on all faith leaders to continue to demonstrate the value of coordinated ecumenical response to COVID-19, involving ACT members, local partners, religious leaders, churches, and other communities to support solidarity-based calls, such as those calling for the cancellation of debts in countries that are really stretched to make sure that they respond to social needs. So I'll stop there, and happy to respond to any questions. And thank you again for the opportunity.
Thank you so much, Marianna, for that. And I know that we would love like so much more time, and I'm very cognizant that we only have about 16 minutes left for our portion, and I have two speakers left and a response. And so I'd like to kind of move on quickly to Tesa Arózqueta. And she's served in various roles within New York City's Children's and Family Services program for over 17 years. And she's currently the director of outreach with the Mayor's Office to End Domestic and Gender-Based Violence, or NGBV. So I'm gonna hand it first.
Hi, thank you, Ivy, Devon, and Houry for having us. I just want to mention that my colleague from the outreach team is also on the call, Zina Sawaget, and she brought me to this forum. So thank you so much. It's really an honor to be able to share this information about what a city like New York is doing right now in response to this pandemic, and what our priorities have been. So we're just really honored to share the work that we're doing, and are here to answer questions and learn from you all as well. So the conversation has been very global up to this point. And so just to provide some context, our office has been in existence since 2001. Our office was created through a voter mandate. So in 2001, New Yorkers decided that the issue of domestic violence was important enough for it to have its own government office to address it. So we are a mayoral office, but we do have an established city charter. So when a new mayor comes in, our office doesn't go away. We are sort of like a city agency. The first thing that our office did was, over the first few years of existence, was create family justice centers. It's an international model. I don't know if you're all familiar with it, but what it is essentially is a one-stop shop of comprehensive, confidential, free services for victims of domestic and gender-based violence. They are walk-in centers. So ordinarily, where someone would have to go to maybe 5 to 10 different places to get help, if they were experiencing domestic or gender-based violence, if you come to a family justice center, all of those services are in one place. So you can get an order of protection, you can meet with law enforcement if you want, although you do not have to. We are co-located with district attorney's offices if that is something someone is pursuing. We have on-site counseling and mental health psychiatric services, immigration, civil legal attorneys, mental health services, services for children, language courses, business courses, education courses, free yoga and transcendental meditation for survivors and their children. There's really so much that happens in these centers. It's hard to encapsulate it in just one conversation here. But just to say that that was really the foundation of our agency, was making sure that in a city of 8 million people, we have one family justice center in each borough, in each of the 5 boroughs in the city. The other thing our office does is we have a policy and training team who advises the city on all sorts of issues as it relates to gender and survivorship. We also have a training team. Half of it focuses on servicing service professionals, training service professionals, anyone who may be coming across victims and survivors, whether that's probation officers, teachers, police officers, children's workers, right? And then the other portion of that training team focuses on youth. I should say all of these training programs are moving to virtual realms during this pandemic, especially when youth are at home from school. This is a great time to offer programming. We also have a data and research team who analyzes all sorts of things around the city so that we can get a picture not only on domestic violence reports, but also city responses. And then we have my team, which is the outreach department, and we focus on doing all levels of outreach to community members. Zina's going to talk a little bit more on that. So before I go into it, I wanted to introduce what our agency is. Last year, we went through an expansion under an executive order. We used to be known as the Office to Combat Domestic Violence, a very sort of violent term. And under this current mayor, we changed and rebranded. So we are now known as END GBV, or the Mayor's Office to End Domestic and Gender-Based Violence. The reason we did that is because we expanded the scope of our work. So we not only focus just on domestic and intimate partner violence now, but we really understand that gender-based violence happens on a spectrum. If you are experiencing one form of victimization, it's likely that you're experiencing multiple forms of victimization along the spectrum. So the expanded scope of our work in the city allows us to look at gender-based violence and follow people through that system and through their experiences, right? And so our expanded scope, in addition to intimate partner violence, elder abuse, and sex trafficking, now includes all forms of human trafficking when it is gender-based. Stalking, sexual assault, so gender-based violence when there is no intimate relationship, family violence, and I think that pretty much sums it up as far as who our office is and what we do. I'm going to talk a little bit about some of the citywide responses during COVID, how to make sure we are really prioritizing connection to people who need us the most right now during these shelter-at-home orders. Before I do that, I just want to allow Zina briefly to talk about what she and our outreach team has adjusted to doing during this pandemic, and then I'll talk about some of our larger city responses.
Thank you, Tesa, and thank you, Ivy. I really appreciate this moment to speak with almost like 600 people. So I would like to just to catch up on what Tesa said. We have family justice centers in each borough, and so with that, we are taking in calls and taking in clients remotely. So we are on the phone remotely, taking live intakes, doing referrals, doing case management over the phone, and then referring clients to service providers for legal assistance, either housing, shelter, and so that way they are still getting the help that they need right now. It's important to note that we're open Monday to Friday, 9 to 5 p.m. But do not worry, we also have the domestic violence 24/7 hotline. So we are still taking in clients who do call in after hours and on weekends. I will share with you guys the contact information. So we really urge all of you all to share that information with anybody that you know, so that way they know that they're safe. There are services for them at this time. And just to add a little snippet, it's important to note that when you call 911, NYPD has a domestic violence officer. And so that domestic violence officer is very well informed in terms of how to cater to domestic violence survivors. So when you call 911, you can ask to speak with a domestic violence officer, and so you will not worry about confidentiality issues. And then lastly, in terms of outreach, so we are really reaching out to everybody from community boards, from city councils, from New York State Assembly, from congressional offices, and even to essential businesses where we've noticed a high increase in domestic violence cases. For example, in Harlem, in Bronx, and in Brooklyn, where we are actually reaching out to laundromats, grocery stores, childcare centers, and pharmacies who are still open at this time, and asking them to post posters of the contact information we have for FJCs and for the domestic and hotline. I think this is it. So I'll take it back to you, Tesa.
Yeah, so I'm watching the time. I know we only had 7 minutes. I'm going to try to encapsulate everything the city's doing to ensure connection to those who need us most right now, also taking into consideration some of your questions in the chat box. So I'll try my best to address all of that together. So yes, within a matter of days, amazingly, and this is all based on the hard work and dedication of our advocates here in New York City and the people who do this work every day, within a matter of a day or two, we were able to move our entire system to a remote system where we could answer calls live and connect people to service providers who are also working remotely from home. You know, and amazingly, most of our advocates who are parents are doing this while they're homeschooling their children at home. So this undertaking has been huge. So we're providing services remotely. As I said, there's services going 24/7, and people have lots of options. They can reach out to law enforcement if they choose. That is not their only option. There are also services that have nothing to do with law enforcement that are also operating 24/7. Domestic violence shelters are considered essential. They are still doing intakes and placing people. They're doing that remotely and through video calls with service providers when they can. There has been some relaxation to the regulations as to length of stay in shelter. So people will not be put out if their length of stay has extended during this pandemic. We are able to extend people's length of stay if they are in quarantine or unable to find housing right now. And all of our service providers are allowing people to do that. Our policy and training team is busy creating tip sheets for service providers that address a couple things. Number one, best practices for working with survivors through technology, whether that's via text. We realize a lot of people are in quarantine with their abusive partners and are not able to talk. You know, what are best practices, code words you can use, how to keep conversations very short, understanding people don't have much time to safety plan and do things that they need to. Also best practices for taking care of ourselves when we're doing this work at home as advocates, and making sure that we are in a good space to continue doing this work. The other thing that we're working on is also working with clients who do not have access to technology during pandemics like this, right? People who cannot get to a cell phone or a computer, things like that. Along those lines, I'm seeing thumbs up, so I'll talk a little bit about that, what the city has done. So the Department of Education has provided every child who needs one with a laptop or a tablet that is Wi-Fi capable. That includes children living in transitional homes, transitional housing and domestic violence shelters. So any child at home should be able to access technology with Wi-Fi capabilities. So that increases parental contact with technology should they need it, right? We are providing programming through the Department of Education as well. There's a ton of food sustainability programs that have been opened up in addition to Department of Education, so school sites where people can pick up free meals. Adults can as well. No one will be turned away for free meals. There's also a ton of ways people can locate food pantries that are open. Here in New York City, we also have delivery services for elders and seniors, people who are disabled and cannot go grocery shop for themselves. I'm seeing that on the chat box as well. So we have activated delivery services for New Yorkers who are homebound and cannot do shopping for themselves for whatever reason. We also have a massive text alert system in New York City. So anyone in New York City who texts the word COVID to 692-692 will get updates from the city. Right now, over 1 million people are getting those updates, and we've been very grateful that with all the services being pushed out through the city, the domestic violence hotlines have been messaged about twice so far during this pandemic. So that means over 1 million New Yorkers are getting information about our hotlines and how to reach us should they need help, along with tips on how to support someone if you think they are experiencing abuse in their home. We have, this was also on the chat box, we have seen a large increase of not only visits to our resource directories online, but new visitors to our resources directory online. So we know we are reaching a whole new spectrum of people we've never reached before. And that is in addition to the grassroots outreach that my team is doing, reaching out to whatever essential business, elected official, hospital social work teams, police precincts, houses of worship, anyone who will hear us and speak to us and is willing to post that information, we're reaching out to them now. I'm gonna keep my eye on the time or a signal. I'm just gonna keep talking until you tell me to stop. I have to look at, nope, should I stop now? Yeah, okay, good. I'm here for additional questions and information about New York City responses. Like I said, it's a lot, and happy to answer any questions. Thank you for this opportunity.
Thank you so much. And really this Herculean, I guess, you know, immense task that New York City has at this time. Really, it's truly amazing. I mean, I live in Harlem, and I think a lot of the people who are on the call today, a lot of them are based in New York City. So we appreciate all the work that you're doing and not forgetting this very important issue of domestic violence. And we only have like a minute, and I'm just wondering, again, since I don't know if Kalyani is on, but if she is, could you unmute yourself and share something? So I also wanted to say that NGO CSW, we're always trying with our monthly meetings to link the local to the global, because I'm sure everybody who's on the call can relate to what's being said even locally in the New York City on into your countries, into your cities. And actually, Kalyani is a gender and environment expert in the advisor committee for the Asia Pacific Forum on Women, Law, and Development. So I wonder if she's on, and if not, then I'm gonna give a second here.
Ivy, I hope you don't mind. I'm gonna jump right in quickly to say there are 2 hands raised, and I suggest both of those hands to chat in the box, because we really don't have time to, I think, unless you think there's time right now, because we gave 45 minutes to the next panel as well.
So yes, we only have the 45 minutes, and I was only gonna be able to squeeze in maybe Kalyani, and I don't think she's on the call. Oh, she is, I see her. So I wanted to give her a minute, and I'm so sorry because I do see a lot of engagement here in the chat and the question. There's one that was addressed to Vivek. Maybe I can address it to him privately, or maybe he's seen it and he can put it into his notes and address that, if that's okay. So sorry, because I don't want to cut in too much to the next panel.
Thank you, Ivy. I've heard a lot, and then I just have very few points. I'm just talking from the grassroots level. And in India, and I'm sure that's the case in other Asian Pacific countries, there's a lot of this informal workers, most of them who are women, agriculture workers, domestic workers, home-based workers, and street vendors who have no access to social protection to begin with. And domestic workers, mostly women, they're worried that they may not have their job back post-lockdown because employers may be apprehensive. You know, low-income women are particularly affected by the slowdown in consumption, and they tend to be employed in hospitality, retail, and other service industries. And so there are many more of that, but I think I'll just put in chat box what I would like to say about that. And I think the other panelists, I think you should be giving them an opportunity. Thank you.
Thank you so much for your understanding, and for everyone. I would like to hand this over to Hannah now to moderate this next panel.
Thank you so much, Ivy, and thank you, Houry and Devon, and everyone who has worked so hard to put this call together. I'm seeing the chat going hot. You're writing so many really important things about different analysis about what's going on with COVID. So I'm Hannah Gunners, and I work for an organization called Women Engaged for a Common Future. You might have seen me around on emails, since I'm at the moment sending a lot of emails regarding training sessions that we're having, and that Houry was mentioning before. So one of the things that came quite quickly after every country started going into self-isolation mode was that we realized there was really a need to strengthen the capacity in terms of technology, and the way our movement is organizing and mobilizing with technology online. So what I've done together with a colleague, Mara, from the Women's Environment and Development Organization, WEDO, we have set up a training workshop series of 3 episodes that's going on at the moment, where we in 3 episodes are tackling 3 different topics and trying to strengthen the capacity of all the feminist networks that we're on. So the first one we had was last week, which was really successful. It was on methodology and accessibility. And the one we had today was more specifically on the nits and grits of technology and a little bit more about software. We will have one on digital security next week. And I will put the links to them here in the chat box for you to see. And if you're interested in joining the one that we're going to have next week, please do send me an email, because I do think it's really necessary. And I read all of your comments, and I saw, for example, Levi Bautista, you highlighted the lack of access to ICT and computer literacy. And I think it's just really important that we help and support each other now, those who are tech savvy, to try and reach out to those who need that extra support and see how we can build bridges between the different knowledge gaps that we have. I don't want to speak too much because I want to give the floor to our speakers. So our first speaker is Bridget Burns. She's the director of a Women's Environment and Development Organization. She's a feminist, environmental activist and director, and specializes in policy advocacy research and movement building in the intersection of gender equality, women's rights and environment, specifically on climate justice. So please go ahead, Bridget.
Thank you, Hannah. Thank you, everybody. It's so lovely to be here with y'all and see your faces, hear from you, hear from friends from around the world. I want to give a special shout out to all of our colleagues who are on this type of technology for the first time. I think you're all doing amazing. It's not easy, and we are all working to find ways to make this kind of technology more accessible across multiple streams and multiple forms. And I also know that this kind of conversation can be difficult if we're not able to get to certain questions. So I'm going to do my best to be super brief, because I would love to make some time to really answer and hear from y'all and the experiences that you are having. So I'm going to share my screen. I have a really brief visual, and I hope you can see it, and you can let me know, someone, if you can't. Can I get a yes if you can from someone, maybe Hannah?
Yeah,
yes.
We can see it.
Thanks, y'all. Okay. So I just wanted to quickly, my name, as said, is Bridget Burns. I'm from WEDO, the Women's Environment and Development Organization. And when this started, when the pandemic really started becoming present in all of our lives, one of the first things that I felt I needed, and I think that many of us in our community felt we needed, was to speak to our feminist allies and sisters from around the world to understand how they were experiencing the impacts of this, and also how they were thinking about mobilizing. And, the groups in which we have particular presence as an organization are in collectives that organize themselves around global processes such as the Commission on the Status of Women, CSW, but also processes around climate change and around sustainable development. And so we went to those allied groups and started hosting basically collective reflection spaces. And so probably for the last month, some of the activities that we've done is host weekly reflection calls that started out very open with no agenda and no anticipation of next steps or outcomes. But of course, I think when you bring a group of feminist advocates together, we really started to think through, okay, how do we respond to this? And how, particularly as women's rights activists and gender equality experts who work on multilateralism, how do we think about the different issues we're seeing at play, and how do we maintain momentum across the broad agenda that we are working on? And so what's happened so far is that collective has led to having reflection calls, having a space, mailing lists, and WhatsApp groups that have been created to gather and collect the amazing amount of information coming from all of your organizations, statements, analysis, experiences, to crafting together a set of principles that have been, there's been a number of documents that have been out there about what a feminist response might look like. And so that's one thing, as groups working in these spaces, we've thought through what are some principles for this response that we could put together. And we've also tried to shift that towards how do we use these responses to be able to lead towards what we all work on in our everyday, which is create more opportunity for storytelling, for campaigning, and then where do we support resource redistribution, not only happening at a systemic level, which is all the work we do collectively, but in this very urgent moment, how as feminists can we come together to meet the needs of the organizations and the partners in which we work with, who are really at the front lines of urgent action and advocacy. And I wanted to share really briefly just some of the reflections that came out of our calls, which has already been stated, and it's clear in the chat box. And so I don't want to spend too much time on this, but these were some of the key things that came out of and have come out of these discussions. First, that this is a deeply personal and embodied crisis. So each of us are facing it every day in our own personal ways, that there are a lot of strengths that feminist movements and women's rights activists have in terms of promoting self-care, and we need to uplift that and show what leadership with empathy looks like in these times, and make sure as we are continuing even in this moment to try to continue our work and continue momentum, we're also leaving space to understand that there is a totally new normal and we have to be very kind with each other. That this is a moment for revaluing and centering care, centering the principles and the responses that so many of us have worked on for so many years. That we know this will have long-term impacts on democratic governance and human rights. That we know this crisis is deeply linked with migration and migrant justice, as well as many other intersections in terms of who is feeling this crisis the first and worst. The impact on the realization that sexual and reproductive health and rights is going to be devastating across the board in many communities, in many countries, and that we have to work together to respond to this. That it requires a collective strategy to uphold and re-envision what inclusive, transparent, and accountable multilateralism looks like, and that it requires solutions that are framed in the context of global justice. And so a lot of our collective reflections, revolutionary reflections on what is happening, is trying to understand in these contexts, how do we move forward and what does advocacy look like? And WEDO as an organization has been trying to kind of frame this around key messages that we think are important to hold on to in this moment, that this crisis is identifying and outlining for us that a world centered on regeneration and care for ourselves and for others and for our planet is the only sustainable future possible. Everything that we're seeing is showing us this, and this is why we as feminists and as women's rights activists need to be at the center of defining what solutions look like. That inequality and injustice are incompatible with a healthy world. And then finally, and this is where I think that I'm drawing hope from in this moment of crisis, and this is also where I drew hope in the most recent report, the scientific report on climate change, which gave us some very dire predictions about how much time we had to really shift our societies to be able to meet the challenge of the climate crisis. But what it said was that we did have time to change. The only question that it posed was whether society could change so urgently and so radically. And I think what this is showing us is that we can radically transform our world to meet global crises if we work with purpose and in solidarity. And it's not happening perfectly, but I think that there are things we definitely need to hold on to. And the last thing I wanted to share is that one of the immediate pieces that it was felt we needed to figure out a way to mark and map what is happening as advocates, to be able to know where the things that we've been told were impossible are becoming not only possible, but absolutely necessary around maybe it's universal basic income or providing universal health care in countries like my own in the United States. Where do we need to mark those policy interventions? Where do we need to mark those observed actions that we're seeing so that we can hold on to them and use them in our advocacy going forward? And where do we need to mark the really, really dire, regressive, authoritarian, and potentially punitive measures that are being put in place in the context of responding to this crisis that we need to make sure we watch, that we monitor, or that we advocate against? And how do we do this in the context of a constantly shifting world where resources are being shared at a scale, resources on the gendered impacts and on the impacts in communities. And so one of the offerings that we tried to make, not just as WEDO, but as this collective of feminists working together and sort of what felt impossible, and then somehow we managed to get a team of up to 20 to 30 volunteers to help make this possible, is the creation of an online portal, which is aiming to serve as a repository of resources and a policy or response tracker, as well as the many amazing online dialogues that are ongoing in response to the COVID crisis. And so just to give you, this is a little bit of a sample of what we're hoping that will look like, and we're hoping this will be available starting next week. And behind the scenes, there's a really amazing online effort happening to both mark policy initiatives that are happening, temporary measures or laws that are being put in place, as well as, I think what's really important is the observed responses that people are seeing in their communities that may not be codified in any law, but that need to be marked and need to be tracked. And the attempt to do this is not so that we spend all of our time creating a repository and collecting space, so it's that we can actually observe what's happening and try to shift our focus into where we need to put our energy and attention, whether that's to supporting campaigns for full-scale debt cancellation, for example, which some people have mentioned, to other work that is really needed and is happening in terms of supporting public health and sexual and reproductive health and rights. So I'm going to leave it at that. As these things become more solidified, we're working very hard on some of these resources and sharing them. And again, we're still all thinking through what the responses look like and what the next steps for advocacy are, as well as sharing and keeping each other up to date on what is happening in many of these multilateral processes. We'll be sure to communicate that with NGO CSW so that Houry and others can act as a broker and a vehicle to all of you. Thank you again for having me on and for being on here. And I hope you're all doing well and healthy and safe with your families. So thanks, Hannah.
Thank you so much, Bridget. I think it's so important, the work that's being done to try and move away from the silos. So I'm going to remove your screen share. Right. Okay. So coming back to me. Thank you so much, Bridget. It's so important in these times, and it seems like everyone has a really hot take on feminist analysis of COVID, and I'm just seeing all these amazing outputs every day, but there really is a need for a process where we're putting everything in place and not working in silos. So I think this is an excellent step towards that. I think what I forgot to tell before I put Bridget on the speaking stool is that there are different ways to leave comments. So if you would like to ask any comments to our speakers, please do so in the chat. You can also raise your hand. You raise your hand by hovering over your name and then you click raise hand. If you agree with the speaker, put a plus sign in the chat. If you disagree with the speaker, put a minus sign in the chat. And if you don't understand something, you want something clarified, put a question mark. With that said, I would like to go to our next speaker, Anya Victoria Delgado. They're the Senior Coordinator for the Feminist Alliance for Rights Center for Women's Global Leadership. And many of you might also have seen this really progressive statement that came out in the very early days of the COVID pandemic. And it came out from the FAR Alliance. And it's called, sorry, I need to find it. So it's called Action Call for Feminist COVID-19 Policy. Please go ahead, Anya.
Thank you. Thank you very much. I'm so happy to be here. Thank you, Hannah. Also, Houry and Divan. Well, my name is Anya Victoria. I'm a human rights lawyer. I'm from Mexico. I'm feminist. And I am the global coordinator of the Feminist Alliance for Rights, FAR. Our global coordinator is the Center for Women's Global Leadership. Are led by a group, by a steering committee, which is formed by incredible feminists from 7 regions in the world. And our mission as FAR is to amplify women's voices, to enhance women's leadership, and bring together women from the global south and from marginalized communities in the global north. And our objective is to influence global policies, human rights norms and processes. So FAR is very committed to facilitate feminist organizing and collective action, precisely to influence policies. So, well, we all have seen that in the last months, states have been responding to this crisis and adopting a number of measures. Some of them could be positive, many of them very negative, but
Sorry, Anya, we don't hear you. You're muted.
I'm sorry. Can you hear me now?
Yes, we can. Please go ahead.
So I was just talking by myself.
No, it was just the last minute. Sorry, the last, literally the last couple of words.
Okay. So well, I was saying that well, our mission is to facilitate feminist organizing and collective action. So we want to influence global policies, and we really want to amplify women's voices from the global south and marginalized communities in the north. So in the last months, states have been taking measures to respond to this crisis. Some of them positive, some others negative, but we realized that very often they were not addressing the needs of groups that were at risk. The most marginalized groups that endure structural discrimination. So our steering committee had, they came up with the idea of developing a statement that aimed to cover key areas where states had to respond, and had to respond using a human rights framework, standards, norms. So we work on a statement that, as Hannah mentioned, maybe you have seen, and we put it out. This was, the idea was that other feminists globally could contribute to that statement. Can you hear me? Okay. So this statement, it covers 9 areas. It covers very different areas. from gender-based violence and intimate partner violence to economic inequality, healthcare, education, food security, abuse of power, access to information, access to water. So as you can see, we tried to cover different areas, but the key was that we used human rights standards and a feminist perspective and an intersectional perspective. And with this statement, we were not able to cover or to address all the specific needs of the different sectors that are endure structural discrimination, but this was a basic document. So we put it out. We asked for endorsements and it was well received. We were very happy because, well, up to date we got, has had 1,500 signatures globally from more than 100 countries, and we are so happy. So, let me share with you the link in case you want to look at it. And
I've actually shared it already, but yeah, that's good.
Okay, I didn't see, but
no, perfect.
So you can look at it, and it is still open to signatures, not to more comments because we had to close it. But when I said that it was well received, was because we received many messages from women from all over the world, from I don't know, like from France to Ecuador, from Argentina to Japan, RDC, like so many messages saying that they've been using this statement. And this was the idea from the beginning, that they use the statement, adapt it to their local needs, and address or develop their own recommendations, and then send letters to the authorities. Because we want to contribute to influencing local policies, right? So we also developed templates that activists could use to write those letters. And the statement has been translated by activists. It was not our work. So they translated it to Spanish, French, Japanese, Russian, Serbian, Bahasa Indonesia, Arabic. So this is also amazing. From our side, we submitted a number of letters to permanent missions of the United Nations. We also prepare a letter with specific asks for it's called Platform of Experts on Discrimination and Violence Against Women. This is a platform which is formed by human rights mechanisms at the UN and from regional human rights bodies. So we sent them a letter with very specific asks, because these mechanisms are important. They can, they have the mandate to draft recommendations to states. So this is the way we are trying to influence both at a very global level, but also locally. And well, we organized the webinar. I don't know if some of you had the chance to connect today in the morning. It was a webinar on the gender impact of COVID-19 crisis. And this webinar was very much focused on macroeconomic policies and how these policies also need to take care of gender perspective to be more inclusive. Well, so this is what we have been doing. And very quickly, I just want to mention, what can you do? Because I think this was the intention of this space. And well, first, I think if you go to the link and you find that it is useful for the work that you are doing, endorse the statement or not, but take the statement, adapt it to your context, your needs, and address authorities. And please remember that we need to address authorities ranging from Ministry of Health to Ministry of Women, welfare, the president. We need a comprehensive response to this issue. also, you can engage with women's human rights mechanisms. Here we don't have a lot of time, but I'm happy to be contacted later. I can give you my email. The human rights mechanisms are trying to document what's going on the ground. And just 2 days ago, the special rapporteur on violence against women, which is one of the women's human rights mechanisms, called for information on how violence against women and domestic violence have increased in this context. So, well, those are 2 ideas, and well, finally, you can always join FAR. If you go to the website, you can find the information and join and receive more information. Thank you very much.
Wow, thank you so much, Anya. I feel so inspired listening to all the really practical tools that you have available and that you've made available for people. I do see a hand raised, and we will get to that later. But yeah, I think it was really amazing that you managed to create like a template that people could adapt to their local settings. I continue to see a lot of questions, or mostly a lot of people just speaking from the heart about the challenges they are meeting personally or within their communities due to COVID. But one of the things that was mentioned, and we saw quite a lot in the first part of the session, was the backlash on women's human rights and gender equality. We've seen a big backlash when it comes to domestic violence and now SRHR. Some of these challenges are new, but some of them are not new. They're definitely building on existing structures of discrimination. So our next speaker, and I'm very excited to announce Anushka Kalyanpur, who's working for CARE, and is the global lead for sexual and reproductive health in emergencies. And yeah, please go ahead. I'm gonna keep your introduction short so that we can leave some time for questions. And again, if you agree with the speaker, please leave a plus sign in the chat. If you need any clarities on anything, a question mark. And if you need to ask a question, just put them in the chat and I'll table them. Please go ahead, Anushka.
Great, thanks so much, Hannah, and thanks to all the organizers and to Devin, who is going to share her screen for the slides. As Hannah said, my name is Anushka Kalyanpur. I work with CARE International on SRHR in emergencies. And today, rather than spending time talking about CARE's response, I would like to really highlight some of our results from the Global Rapid Gender Analysis. As you know, CARE is an international humanitarian and development organization. We work in 100 countries around the world, focusing on saving lives in emergencies, but also finding long-term solutions to fighting poverty. And gender is really part of all of our work, particularly with women and girls. First slide, please. So I will be talking about our rapid gender analysis. So essentially, a rapid gender analysis, or an RGA, is essentially a tool or an approach to provide information about the different needs, capacities, and coping strategies of women, girls, boys, and men, recognizing their intersecting vulnerabilities and based on changing gender and social norms as a result of a crisis. It does this by examining the roles and relationships between women, girls, boys, and men. And essentially, a rapid gender analysis is a iterative process or something that is built up progressively over time. It provides an initial but often incomplete analysis of gender relations in an emergency, because we know that when an emergency or a crisis occurs, that the impact of gender and social norms may change. And we want to be able to, very quickly tell the story and understand how these things are changing. So the 3 key principles that guide the RGA approach are to do something fast or quickly, to be progressive and build up over time. So you might conduct an RGA at the beginning of a crisis, but then again in a month later as things might have changed. And most importantly, we want it to be something that is practical. So like others have shared, we want to do this quickly so that it can inform practitioners, donors, policymakers, etc. So essentially, really highlighting that this is an imperfect thing, but it's meant to be able to get information very quickly to inform practice. So since 2013, CARE has conducted about has conducted rapid gender analyses in over 50 countries. And it is not a tool limited to CARE. This toolkit is available online, and we highly encourage others to take it on, conduct it in their own context, etc. Next slide, please. So essentially, as soon as COVID-19, the outbreak began, we recognized that disease outbreaks affect women, girls, men, and boys, and persons of all genders differently, as well as at risk and marginalized groups. The impacts of COVID-19 with the compounding complexities of development or humanitarian contexts are obviously likely to have disproportionate effects on women and girls and these vulnerable groups, exacerbating the pre-existing gender and intersectional inequalities, as others have mentioned. So essentially, as soon as this happened, we undertook a policy paper to look at the gender dimensions of COVID-19. And then undertook this global rapid gender analysis that I'll be presenting some high-level findings on today. But then since then, we've also undertaken regional rapid gender analyses in the Asia Pacific, in the Middle East, North Africa region, and currently we have them ongoing in the other regions as well, Latin America, East Central, Southern Africa, and West Africa. So again, all of this is available online. Next slide, please. So moving quickly to sort of the findings, and I will keep this limited and not repeat what others have said, but essentially we know that men and elderly populations are most affected in terms of COVID-19, but we also know that global sex and age disaggregated data is limited. So we really need to unpack this, because we know that even though on the surface men and elderly populations might be more affected, we know that women and girls often experience secondary implications stemming from health crises due to gender roles, responsibilities, social norms, including division of labor inside and outside households, paid and unpaid work, access to and control over resources, both in the household and community. Other presenters have already talked about the caregiving burden, so I won't go into too much detail there, but I especially want to highlight what this means in the context of weaker and fragile health systems, including in fragile contexts and emergencies. I also want to highlight the importance of women in leadership and decision-making. We know that globally 70% of workers in the health and social sector are women, but over 70% of CEOs are male, and only 5% of them, of women from low and middle income countries are in leadership positions in these organizations. So this, really demonstrates the extreme discrepancies in leadership and in decision-making. I won't go into too much detail on that, since I know others have mentioned this too. But also just highlighting that while women should not be further burdened, it's really crucial that we acknowledge and really provide opportunities for incorporating women's voices and knowledge in all stages of both outbreak preparedness but also response. Next slide, please. So in addition to sort of those cross-cutting findings that others had mentioned, I do want to delve a little bit deeper into the key sectoral findings. So we know that gender-based violence is increasing. From the very beginning, women's rights activists in China had reported that domestic violence cases had increased dramatically, especially as quarantine measures were implemented. We know that sexual exploitation and abuse is usually an impact in crises, and this is of specific concern given the economic downturn, food insecurity, and loss of income employment opportunities can really can result in a spike of sexual exploitation and abuse. This was noted as well during Ebola and had increased risk for women, girls, and at-risk groups. And then access to sexual reproductive health and healthcare. The scale of COVID-19 pandemic means that resources are already being diverted from existing health services to support the crisis. In some contexts, this may lead to a shortage of health professionals, financial resources, and medication and supplies to support critical life-saving sexual reproductive health services. We know that reductions in sexual reproductive health and rights services will have greater impacts on clients who rely on free or subsidized care, particularly women and girls and other marginalized groups living in poverty or already facing other barriers to care. This is particularly worrisome in contexts where there are already restrictive laws, weak health systems, as well as restrictive or unequal gender and social norms. Next slide, please. So we know that, that over 35% of women globally will face gender-based violence in their lifetime. In humanitarian crises, this is compounded, especially as there are increased levels of stress and anxiety during economic hardships. We know that with lockdown and violence, particularly with mandatory lockdowns, often this can mean that women are trapped with their abusers, and that it is even more challenging for them to access their support systems, support networks, including family, friends, and other services. We also know the availability of GBV services will be weakened with limitations on mobility, as well as availability to support these services. Next slide, please. Unequal access to healthcare. So just going into a little bit more information on that. We know that poverty is obviously a huge factor when we think about access to healthcare. We know that older people and persons identifying as having a disability are particularly at risk, both in terms of physical, but also thinking about the mental health and psychosocial impact that social isolation might have on the elderly, who often are already in normal times, facing some of these challenges. I also want to elevate the unique needs and exacerbated needs of refugees and migrants, including those living in internally displaced and refugee camps, informal settlements, who are already facing living in overcrowded conditions with a lack of access to sanitation facilities, water supplies, and limited health services, making COVID-19 prevention, such as social distancing and hand washing, even more difficult. We know that in contexts like the border of Colombia and Venezuela, that with the border crossings, you have Venezuelan migrants who are often, accustomed to moving across the border on a regular basis for access to health services, are now, unable to actually access those.
Sorry, Anushka, please wrap up in the next minute so we have time for some questions.
Oh, sure. Okay.
Yep.
So maybe just moving on to the next slide around sexual reproductive health and rights. So I think, we've already talked about this a little bit. I think I saw in the chat box that others had highlighted the needs of adolescents. I do want to really highlight this. We know that from Ebola, for example, that it was actually services related to non-Ebola that were affected and then resulted in reduced access to family planning services and unplanned pregnancies. With the school disclosures in particular, this impacted adolescent girls and resulted in unplanned pregnancies. A lot of them had to actually drop out of school. So I think maybe just going to the last slide, slide 10, around recommendations. Again, this full, rapid gender analysis is available online, but really highlighting, the importance of investing in adapted approaches to meeting the unique needs of women and girls, ensuring that women and girls are involved and provide leadership in the decision-making and preparedness and response, and ensuring that we're not diverting resources from critical life-saving services on sexual reproductive health and rights, with the minimum initial service package for SRH in crisis. So I will pause there and handing it over.
Thank you so much, Anushka, and I'm sorry for cutting you short. It's a very interesting presentation you are giving to us, and I wish we had more time. But I do want to keep the floor open for questions. There are some questions that's popped up in the chat that is directed to all three of you, and I'm gonna read three of them, and then you can, Bridget, Anya, and Anushka, you can volunteer who wants to answer which question, okay? So the first question we have is, how does our post-COVID future look like to you? And what do we need to get there? Is it the normal we want, or do we want a new normal, sort of? The other question we have is, in terms of mobilization, so you're all doing a lot of mobilizations of your partners or networks. In terms of mobilization, what are the challenges you are seeing, not just in moving online, but I know there's a lot of structural challenges as well. And what are you doing? What are you learning from these? And what could other people learn from the way you are tackling this issue? And then, like you all have talked about these amazing initiatives that is going on, and how do we gather strength together and ensure that we're not working in silos? Because there's so much amazing output coming out at the moment, but I do feel that there's quite a lot of siloed work happening, not just within civil society, but also within UN agencies or other stakeholders. They're also doing similar work to what civil society is doing. So those are three questions for you to start with. Anyone who feels like they want to start, or should I just call on you?
I can jump in, and I'll be really brief. This is Bridget. I actually can't start my video because I think you turned it off, Hannah, so you can throw it back on if you want. There we go. So for me, a really quick question on the new normal piece is that I think we've all been collectively working for decades on a new normal. And, you know, I think, again, I go back to that key message where I don't necessarily like framing this as a challenge and an opportunity, although, you know, that's kind of language you can use. But everything that we're facing, the climate crises that we're facing, and this public health crisis, just like climate, is a feedback of our global system. One that is overtaxed, one that is overconsumed, one that doesn't have sustainable production and consumption patterns, and one that certainly doesn't prioritize human rights, let alone women's human rights. And so I feel really strongly, as I think many of you do here, that so many of the things that we have pushed for decades in terms of feminist responses to broad issues, to ensuring gender equality, to ensuring social protection. And I really think this is a space for feminists in particular to lead on what a society that is centered on social protection and care looks like, and why that would be fundamental and is fundamental to a just recovery. So I think part of the collective revolutionary reflection and tracking that we're doing as collectives is to be able to respond to what a new normal looks like. And then the last piece I just wanted to say, it totally left my mind. What was your last question, Hannah?
Yeah, so it's how do we avoid working in silos?
Yes, sorry, that was the piece I did want to. This is, I think we're all kind of loath to work in silos and to recreate wheels and to not be making offerings that actually advance us and take us forward. And so, you know, one of the exercises that we undertook when deciding, do we want to spend time and energy pulling together a repository, was to reach out to the many collectives that had already created repositories and actually say, is this useful? Can we do, you know, could we do this together? But to also move forward quickly. And so, you know, and for us, this is a really important moment. And that's exactly the reason why we didn't just have a conversation with the activists that we work with who work on the Commission on the Status of Women. We pulled in the allies who work on climate change, who work on sustainable development. And I've been on calls this morning with the UN climate negotiations, sharing with them exactly what I shared here on this call, because I think we as organizers actually have tools to support and build skills of UN agencies at this moment. And so I think this calls upon us to think of partnerships in a new way, in a different way, and to be unafraid to work collectively to break down those silos. So it'll continue to be a challenge, but the more we can recognize we each have a valuable role to play in this, whether it's observing our realities and sharing them through stories or creating collective resources, that being in community is what is going to actually create a good response.
Great, thank you so much, Bridget. I do realize it's 2 minutes past 9 in my home country, but I don't know what it is for you, but please do stay on for a couple more minutes as we hear from Anya and Anushka. And any question that I didn't get to today, I will send it to the speakers later on, and they will be happy maybe to share that with NGO CSW so they can share it with all the participants later. But I saw, Anya, you bumping your head a lot in agreement. So I think you had something that you wanted to add to some of these questions. So please go ahead.
No, well, it is because Bridget said all what I wanted to say. And I just want to add that we need to focus on accountability, and not only state accountability. IMF, World Bank, like there are so many actors. We have to call them. And now the challenge is how to identify those opportunities, because I think all of us are working a lot and it's not sustainable. So I agree, and I like the third question, how we avoid working in silos, because this would be the only way to have an impact, to challenge those structures. And just to wrap up, I want to thank you for this opportunity, because this is what is going to help to break those silos. What NGO CSW is doing, what many networks are doing. And I think now we have to be very aware that not many people are as privileged as us to have a computer and to have conditions in their house, to have internet, and to have maybe to be free of intimate partner violence, right? Something like that. I can just see it and I have someone who is taking care of my baby. So, which are our, what do we have to do to facilitate those other people can also voice, can also express, and can also, how can we also hear from them?
Yeah, no, I fully agree what you're saying. You say that, okay, we are here already, but how do we mobilize to make sure that we reach other people who cannot be here? So in other ways than just the technological mobile internet space.
Mm-hmm. Yes.
Mm-hmm. Yeah. Thank you so much, Anya. Any last comments?
Okay. I just want to say a big thank you, and I think that Bridget's points really encapsulated what I think all of those responses should be around more equitable partnerships and systems. And I think we're at a point that it's a challenging one, but I think there's a lot we can also learn from the really great pivoting and adaptations that many organizations and civil society organizations are really leading the way on. So I think this is an exciting opportunity. So thank you all.
Great, thank you so much, Anushka. And do you have any takes on the questions in terms of how do we break the silos, or is there anything that you feel from your networks that you've done that you?
I think, similar to what was said, I think it's about working in coalitions, working in community at all the different levels that we work. So, and again, I'm saying this, and as I'm saying this, I realize this is from my SRHR silo, but we work within the IWAG, the Interagency Working Group for SRHR and Emergencies. And I think it is, lifting up the barriers and the breakthroughs that we are seeing on the ground as it relates to SRHR through those global networks, to then, hold the WHO and UN and other systems more accountable, as Anya mentioned, So again, I think like someone said before, it's connecting the local to the global, global to the local, through accountability approaches and really strengthening that collective at the various levels. So yeah, thank you.
Wonderful, thank you so much. And thank you to everyone who stayed on. I'm gonna hand it over to Houry.
Thank you so much, Hannah. I think I want to sign a contract with you. Will you please be our moderator anytime we need one? You were fantastic. Thank you to all the speakers. I have so many things to say. I want to thank everybody who stayed on. I know we're over time, and we will share all of this information. About funding, there's so much I want to say there in response to some of the comments. And we thought 2 hours was going to be too long, but look at this, and we still need more time. For funding, just recently I listened to, I think it was Skoll that went online, and there was a discussion with 3 people. I'll find the link and I'll share it with everybody. Ford Foundation is doing some amazing work in collaboration with other foundations and donors in trying to rethink on how to get access to funding and to kind of, especially at times like this, to make it easier. And then as far as the one pager, I would say, depends on how fast we can put this together. Hopefully 48 hours. We could send the minutes and these information within 24 hours. Perhaps we'll wait and make sure we'll put everything together. I'm just so excited because, like I said, this was our first monthly meeting online, and I have a feeling, and some of our local members might not be happy about this, that this online version is a much more accessible and better way of doing our work. Sometimes you're going to hear, like, you don't have to join the business meetings, because in the business meetings, sometimes we do a lot of our own work that we do right here in New York City. But why not all of you learn about that too? Because most of you are engaging with us because of the work we do during CSW, the forum that we put on. So that's some of the news that we share all the time. But we do have these monthly, and we will keep doing it. And I'm just so grateful for every single person. I don't know where to start. Vivek, Bridget, Anushka, everybody, just in New York City. We had obviously invited even more people, so perhaps we'll continue this next month. We'll see how we can engage again. So again, thank you all. I don't want to keep you here much longer. I want everybody to take a minute to turn on their videos and their microphones, and then we can all see each other's faces and say hello, even though the computer might crash. And please reach out to us at info if you were not heard for some reason. Yes, everybody wave.
Thank you, thank you, thank you. Thank you.
Thank you.
Thank you. So happy to see all your faces. Thank you. Yes.
Bye.
Bye.
Bye bye. Thank you.
Thanks, everyone.
Bye.
Bye.
See you soon. And please take good care of yourselves. Sending healing light and love to all.